Welcome back to The Source. In addition to being treated for COVID-19 at Niagara Health locations, some patients are also helping to improve our understanding of the virus through participation in clinical trials. Dr. Jennifer Tsang is here to update us on the importance of the studies happening right here in Niagara. Dr. Tsang, thank you for taking time to visit with us today.
Thank you for having me. It's my pleasure to share with you some of the exciting research that we're doing at Niagara Health. And to answer your question, the reason why it is important to conduct research at Niagara Health is such that we could provide our local patient access to clinical trials. Otherwise, they wouldn't be able to receive potentially effective therapy that is state-of-the-art. We at Niagara Health was involved in a few large-scale trials, some of which had already led to a change in practice. For example, you might have heard we now use steroid for the treatment of COVID-19 in the hospital. We have contributed to the result of this study that led to a global change in practice. So it's very exciting that our patients were able to participate in clinical trials locally.
You've been very vocal about the disparity between where people are treated for COVID-19 and where most of the research typically is done. We're treated here at local community hospitals, but the research is done at these larger research hospitals, and you're trying to change that.
Yeah, you're right. And when I look at the Ontario data, since the beginning of the pandemic up until the beginning of this year, around 75% of patients were treated in community hospital with COVID-19, and the majority of studies are carried out in academic centers. But I have, through my work and my colleagues' work, we have made some changes. We have been engaging community sites in addition to Niagara Health to participate in COVID-19 in the hope to increase the number of patients that we could involve in clinical trials, because that way we can speed up the completion of studies and we can learn what therapies work and what therapies that don't work to save costs and to save lives.
Your most recent press release named 4 such studies: the CATCO, the REMAP-CAP, the COVID-PRONE, and also the ACT. What are these all about?
Oh, thank you for asking. So the CATCO study is the Canadian arm of the WHO Solidarity Study. So it's done in conjunction with the World Health Organization. This study, we looked at the use of remdesivir in the treatment of patients with COVID-19. It is still ongoing. Some center has started using remdesivir for the treatment of COVID-19, but we're still not sure whether this is truly effective. So we are still doing study on that. The REMAP-CAP study is the study where we looked at the use of corticosteroid. And that study has been published, and we now use corticosteroid in patients with COVID. And the COVID-PRONE study is interesting. Basically, we're trying to understand whether putting patients in a prone position, so belly down, whether it would improve their outcome and decrease the chance of them going on the ventilator. And the ACT study is an outpatient study. So for example, if someone were to be diagnosed with COVID-19, but they're not sick enough to come to the hospital, we monitor them outside of the hospital and we consent them for either placebo treatment or either no treatment or medications to see whether the medication can help them improve their outcome and prevent hospitalization.
Back in January, the federal government announced $6 million for COVID research nationally. How much of that money trickled down to Niagara, and how will that help with you continuing these types of studies?
So we got the money recently, and we are still going through a discussion with the big team. It's a big team of scientists and researchers across Canada that got this funding. So there's governance model that needs to be formed, and we're going to discuss about utilizing some of the funding to support sites like Niagara Health to support their research infrastructure so that we can continue further future study to enroll patients locally.
It's so interesting. Dr. Tsang, thank you so much for joining us. And can we check in with you in another couple of months and find out how things are going?
Absolutely. It will be my pleasure.
Thank you so much.
Thank you. Take care.